Dr. Burgess was talking about is in your packet. This was done by the Joint Economic Committee. If you haven't seen it, it's really a remarkable piece of work. It's not just a chart with a bunch of circles and graphs and squares and diamonds. It really is a conceptual depiction of how 1/3 of this piece of legislation is supposed to work. And when you look at it online, you can see that all these little connecting lines are the section number for the bill that gives the authority for, as you see, the center of this is the Secretary of HHS. The Secretary shall is in there about 2,500 times. And this is just some of the authorities that really move from HHS over this legislation. So I really encourage you to take a look at that and be very afraid. The long list of problems, of unintended consequences that we're seeing as a result of this legislation started just a few days after the bill was signed, when we heard Caterpillar and AT&T and several other major companies saying, as they are required by law to do, that they were going to have to take an earnings hit as a result of some of the tax provisions in this legislation. And then it came out that, oh my goodness, well, it also is clear that they're having to rethink whether or not they're even going to offer health insurance. When health insurance, the fines are only $2,000, and health insurance costs $7,000, $8,000 for an employee, sometimes more if they have dependents. They have to do the math. And then we heard that a number of companies, we began to see a domino effect of insurance companies were dropping child-only policies as they began to see this is just not a market. When somebody can purchase health insurance when they're sick and drop it when they're well. So companies said, we have to get out of this market. And we saw a number when the provisions were announced that are sort of the early sweeteners of this legislation, the 26-year-olds on their parents' policies, the pre-existing conditions without coverage, the free preventive care, that was actually going to increase healthcare costs. Then McDonald's. Then we heard McKinsey, an analyst from McKinsey speaking at the AHIP meeting a couple of weeks ago, saying that 80 to 100 million people could lose the coverage they have now after these provisions go into effect into 2014. Well, most of them are going to get other coverage, but they're not going to be able to keep the same policy or the same structure policy. Then we learned the SEIU, one of the huge supporters, the Service Employees International Union, we just learned today that in New York, 6,000 home health care workers are no longer going to be able to have dependent coverage because SEIU says we can't afford to cover children up to age 26 on these policies, so they're dropping dependent coverage altogether. So that's just the beginning of the cascade of changes in our health sector that are really causing people a lot of problems. The IPAB, I mean, that really gets back to the whole question of who's going to be in charge of medical decisions. Is it going to be government or is it going to be us? And I think that's why you're seeing pressure coming from a number of different sources. You're seeing pressure coming from the federal level with the efforts just yesterday to try to repeal the 1099 provision. And very interesting to me, and I think this may be a harbinger of things to come, where you saw that the vote for Republican Senator Johan's repeal effort, which would have told OMB to just find the money to pay for it from existing funds that have already been appropriated for the stimulus, failed. This is only in the Senate this can happen. It failed by a vote of 61 to 35. It needed a 67 vote threshold to pass. So in the Senate it failed with 61 votes. Senator Baucus's measure failed by a vote of 44 to 53. So if that's an indication of things to come, where more Democrats joined the Republican bill, then I think that's really going to be a very interesting conversation next year. So you're going to see federal level action, you're going to see state level action, you're going to see the legal battles, and I think you're going to see a lot of pushback against the regulations that are going to be coming. So in the House, the tools, and a piece in the Wall Street Journal that I have there: defund it, dismantle it, delay it, disprove regulations, direct oversight and investigation, and delegate to the states. So I think you're going to see battles on a number of different fronts. And I would like to invite Joe Entos to be our first speaker, who is the Wilson H. Turner.